With us, he's from Sydney. He's 33-year-old, and you can see that his walk is very unsteady. He has difficulty walking and maintaining balance. Come back, please come back. And this is going on for quite some time. He actually came for lumbar spine surgery. He was advised lumbar spine surgery in Australia. So how long you have been suffering from this?
Since February last year, 2022.
More than 1 year.
More than 1 year, yeah.
And it started like how? What was the first symptom?
It just, I slipped over and then my knee swelled up. And then slowly I just started getting pains through my back, my buttocks area, and then I started losing feeling in this leg. This leg's good, but I can just start to feel numbness on the bottom of my foot.
And you always feel like there's numbness in your ankle and
it
feet.
feels like I'm wearing socks all the time, even if I don't.
Once more. So you have to use crutches most of the time.
Because I feel like I want to fall over every time I step.
So this is typical of our upper spine problems, what we call upper motor neuron disease. When we have anything above anything pressing on the spinal cord. But the good thing is that your hands are not involved because it's somewhere around C7, D1. So that's why your upper limbs are spared. Any problem with urine?
No problems with urine.
You can write, you can type.
I can write, I can type, I can drive, I can move the steering wheel, I can do stuff around. It's just standing and walking is the painful part.
And what is the maximum distance that you can walk?
Maybe 50 meters at best, and then I'll have to take a rest, and then get up again, have a rest.
50 meters stop, 50 meters
50 meters
stop.
Yeah.
Come. All right. Just lie down. I would like to examine you again. I'm touching here. Can you feel it?
Slightly.
Slightly. And here?
Same feeling.
Here it's fine?
Yep.
It's better here?
Yep.
So below knee there is loss of sensation, partial loss of sensation. Similarly on this side?
Yep, same.
Okay. Pull your toes up. Pull. Keep it pulled. Yes. Press down. Alright. So you have good power. And now we'll have a look at the reflexes. Bend your knee. This one also. Okay. Just relax. So this is the primary feature of upper motor neuron problem. You can see the jerks are very brisk. Less on this side, but more on this side. And this is the limb which is more affected. Yes, that is the problem. So this simply tells us that there is a spinal cord compression somewhere. And actually, Makalo came for a lumbar spine surgery. You were advised a lumbar spine surgery?
Yeah, I was diagnosed in Australia with bulging disc in the L4, L5 region.
But on examination we found out that it is actually a cervical spine problem, and we got the MRI done and CT scan done, and we found out that there is a compression at C7, D1 and D2. Any questions you want to ask?
Forward.
Are you scared?
I think everyone gets scared when it comes to surgery, but
yes.
I have full faith in you and your team.
Pillow. We are with Mr. Makalo. He is from Sydney, Australia. He is 33-year-old and he is suffering from cervical spine stenosis. And considering the condition, considering his body weight, medical condition and all the things, we have explained the type of risk involved in the surgery. It's a high-risk surgery because of the location of the stenosis. It is in the C7, D1, D2 area. That is a very tight, it is actually the tightest area in the spine. And because the condition is long-standing, when we decompress it, there are high chances that there will be edema, swelling in that area. It is a reactionary edema basically. Something is compressed for a long time. When you give it space, it suddenly gets swollen. And that might translate into weakness in your lower limbs, inability to walk, and possibly bowel bladder issues that might be for few months to few years. And because you have traveled such a long distance, you have to go back to your country, you have to fly back. There is a possibility that you might be on bed for a long time. So transportation might be an issue.
Or we can stay here
Or you can stay here,
until he's better.
but for how long? That is another question. So I hope you understand all these things.
I'm confident. Are you confident?
I'm confident in doctor,
I'm
but
confident
only if
in
you're
your
confident.
yeah, I'm confident.
I'm confident in executing the procedure, no problem. But
But you
these,
don't know what's gonna happen.
The recovery.
these are the possible complications.
And it's your job to notify us so we know about it.
Yes.
Yes.
So, and then it's our decision to make.
Yes, that's what I want to be very clear about. And every patient, if there is a high risk surgery, we always explain things.
Yeah.
This is a part of it.
Yeah.
Counseling and recording that is a part
Yeah.
of it.
I feel like I'm deteriorating. Like I feel like I'm like slowly. This for me, for us, like we've discussed this for the last 6 months. Like this is pretty much it. Like we've tried to do things in Australia and
As I suggested yesterday, it will be much more convenient for you to get it operated in Australia.
Correct.
It will be more easily manageable for you.
yeah.
I understand. He won't get it done, but I already know. One, the waiting time is already 2 years.
Okay.
The private health is already 1 year, and the gap of the money is still
Okay.
large.
Okay.
And he trusts you and only you to work on him. Whether it's worse, at the moment,
Yeah.
this is his worst.
Okay. Okay. So this was our most challenging surgery of last few months. Though we are very used to doing it, but in last few months this was the most challenging, and I would say it was most unpredictable because cervical spine can the way you expect sometimes it doesn't behave that way, and we have a very brave patient from Sydney, Australia. So seeing a result is a combination of many things. One, correct diagnosis. Second, your willpower and our surgical skills. And last but not the least, the technology provided by the hospital. We have the best equipments available for the spine surgeries, for these delicate spine surgeries. So it's a combination of all this plus a bit of luck.
There's a bit of luck.
Yes, definitely in this case, because many a times when we decompress a tight cervical spine, it sometimes gets edema, swelling, and the circulation to the lower limbs and to your bowel and bladder can be impeded temporarily. Now that temporary period can be few weeks, few months, and can be few years. And that's what I told him and his wife, that this can happen. And that simply means that the patient cannot walk. The patient cannot pass urine. They don't have control over bowel and bladder. So these are high risk surgeries, and there should be a transparency between the doctor and the patient that this can happen. So we took a proper consent. He agreed to it. He was ready to take the risk, and because he's from Australia, traveling back could have been a bigger problem. So he had made arrangements for that also. So when everything was settled, then we went ahead. And for our orthopedic viewers who are surgeons themselves, these surgeries should not be done with rongers. They should not be done manually. They have to be done with very fine burr. When we take off the bone, we should not take the bites and in bits and pieces, because we might damage the cord. So what we use a very fine high-speed burr. You understand burr? It rotates very fast. It has a diamond tip. So it cuts the bone in very like a powder.
Fine.
Like a powder. It makes the powder of that bone and it slowly takes off the things.
Instead of chipping away at it, it's better to fine grinders.
Yes, it's like a grinder. Yes. And it stops once the bone is off. So it doesn't go beyond the bone. So it makes the things much safer. So it is part of skill plus technology, both. And I'm really thankful to my hospital that they have provided us with such equipments. And we'll just make a small walk. And are you able to climb stairs? Have you tried? We can try. Third day? It is third day?
This is the third day.
The third day post surgery. He is walking with crutches because in a cervical spine patient, the first symptom is lack of balance while walking. And he is still using it because the complete recovery will take time.
The balance, doctor.
Huh.
It's just the balance is, and the trust is.
So I've been walking
the
on the
power's
wall with
back.
no crutches?
Yes, you can. You can walk with or without.
Okay.
It's your choice.
Without is looks good for me. So yeah,
I'll use the wall.
you know you're not gonna fall. So.
So be slow. There's no need to be in a hurry. So you can still see that the gait is still wobbly, gait is still unsure, because this symptom will take time. But the best part is that it has not worsened. He is walking independently. That's a great achievement for us, because many of these patients, they come on wheelchair after post surgery, but he is doing very, very well. And considering his size, it was difficult for us, had he been on wheelchair, to manage him, but it's by God's grace that we were able to achieve this. Excellent.
Yeah, it's just the balance.
Yes, balance is the problem. What is the major difference post surgery? Anything that has changed?
The pain.
You had severe pain.
Yeah, it's just all like in this one spot. I always had bad pain. So even just a step, I'll be like grunting. Like just...
In fact, that was the confusing factor for your surgeons in Australia.
Yeah.
This pain means lumbar spine.
Oh, okay.
Gluteal pain generally means lumbar spine.
Yeah. So how does that like? How did it get eliminated like from the surgery up more?
Because all the nerves are coming from there.
The communication.
So if there is a compression, it can affect sometimes your upper limbs, but always your lower limbs.
Yeah.
And you feel a tightness. When you have compression there, you feel a tightness in your limbs.
So that's why I was thinking to myself, like, I've been diagnosed mid-spine, yet, like, when we look at the diagram, it says, like, L4, L5. So I'm thinking...
But there was no compression.
There was no compression there.
They didn't do an MRI in Australia. They didn't suggest to do an MRI.
Yes, yes.
That's where the diagnosis.
And I think, the waiting period there and the difficulty in getting the investigations, with due respect to the health system there, but I think there is some difficulty in getting to the proper diagnosis and proper investigations.
In saying that, I don't think they have the technology that they have in this hospital as well.
And that way, I think citizens of this country are very lucky that they have all the investigations, all the surgeons, all the technology available practically at their doorstep. Whenever they want it, it's available.
It's there for them.
Yes. And first day you had numbness and weakness in the thighs. That is another thing that I would like to highlight, that if there is a heavyweight patient and they are lying prone for 3-4 hours, there are high chances that the femoral nerve gets compressed and your quadriceps can become weak. But it is only for few days. Then it starts recovering.
Yeah, that was the worry that I had the first night.
So any patient who is getting operated like him, and after surgery you feel weakness in your thigh muscles, it is normal. It will take few days, it will get better. So there's nothing to panic about. Okay. So let's try climbing stairs. Are you sure? Without crutches?
I'll use one.
Okay. All right.
Because I always, every time I walk up the stairs, I take one step at a time.
Okay.
I never double up.
No problem. You do the same way. No problem. Yes. So these are very significant steps in his recovery, I would say, literally. And as the time goes by, things will get better.
Very fast. What this one?
So in all these cases, the family support is equally important. They need to be supported physically, mentally. And once the patient comes to us, we also become part of the family.
Give his face.
Yes, they smile.
I used to have so much pain walking up and down the stairs.
Now? Nothing? Oh.
Great. So, are you happy? Oh. Great. So,
Thank you so much.
Yeah, it just means the world. My parents rang from Australia last night, sending their best regards and saying, please thank the doctor for all the hard work he's done.
It's okay. Rather, we are very thankful that you came all the way and you trusted us, and it's a big compliment to my team basically. We have worked together for years for these results. We wish you all the best.
Thank you.
And now you can look forward to doing things in life.
Yeah, getting back. I have 3 kids that have been missing their life for the last 12 months. And getting back to normal life and enjoying life with my kids. It's the quality of life that you always say in your videos. That's what really got to me. And we've traveled all this way, and like what you said in your videos is true. Getting the quality of life back.
That's what we want to achieve with orthopedic surgeries. These are not life-saving surgeries, but they add so much to your life.
Life-changing.
Yes.
Life-changing. Thank you.
Great. Thank you so much.
Thank you. Thank you.
Very grateful.
Thank you.